In today's video, I've got some crucial information to share. 12 subtle signs of a stroke that you may be overlooking. The signs of stroke are not always obvious. In fact, these are signs that often go unnoticed. Let's discuss the symptoms now before we discuss the signs. It's really important to know the main symptoms of a stroke. If you're feeling skin sensitivity or numbness in your hands, feet, or face, that's a big red flag. But there are also some quieter signs you should be aware of. Let's dive right into those. If you are dozing off without an apparent reason, it might be a quiet sign of a stroke. It's not just about long working hours or fatigue, it's a red flag. You may mistake your nausea as an after effect of eating fast food like burgers, pizza, etc. But if it's persistent, be careful. Above all, if no stomach pain or diarrhea is accompanying it, it's time to take it seriously. Sudden seizures without a history of epilepsy? Stroke might be the culprit. Don't overlook it. Get help. If your hiccups are lasting for hours or even days, especially when combined with numbness or dizziness, it's not just a regular hiccup, it's a potential quiet stroke. Moreover, if the frequency of hiccups has increased, you should be alarmed. Whether it's temporary, constant, or episodic, pain on one side of the face or body could be a signal. Even frequent headaches should raise concern. Fainting due to low blood pressure or low blood sugar is one thing. But if you are fainting out of the blue, my friend, you need to see a doctor right away. If you can't remember parts of your day or a place you visited, it's linked to stroke. Don't brush it off. It's a warning. Do you often feel confused about time or place? It could be a sign of memory issues. Don't ignore it. Talk to a doctor. Mini strokes might contribute to dementia. Feeling a bit off, like having unusual thoughts or behaviors all of a sudden? It might be linked to a stroke, even if you've never had any mental health issues before. It's important to take it seriously, even if there's no past medical history. If your vision suddenly gets blurry or you lose sight in one or both eyes unexpectedly, it's another subtle sign. If someone suddenly finds it hard to stay balanced or coordinate their movements, it could be yet another sign of stroke. Notice any changes in how they walk? Keep an eye on it and consider seeking advice if needed. If you're suddenly having trouble swallowing, especially alongside other symptoms, it's another sign to notice. Let's take a moment to discuss some things that might increase your risk of having a stroke. Now, these are considered significant risk factors for having a stroke. Interestingly, steering clear of some, if not all of these, can substantially lower your chances of experiencing a stroke. It's really about making small changes that can add up to a big difference in maintaining your health. Of these things to avoid are high blood pressure, heart disease, smoking, high cholesterol, and diabetes. Now, let's have a look at the stroke emergency that everyone needs to know about. You need to remember FAST: face, arm, speech, and time. F: faces changing expressions. A: arm weakness. S: slurry or changed speech. T: time. Every second counts. The patient needs emergency help right away. If you observe the following major signs, rush to the hospital or call the emergency line right away. Keep in mind, speaking with a health expert is the best way to really get the full picture of your health situation. Stay healthy, and I'll catch you in the next video. Thanks for watching, and if you found this video helpful, I'd be really grateful if you could give it a thumbs up and subscribe to my channel. Your support means a lot to me, and it allows me to create more content that can be useful to you and others. And one more thing, don't forget to hit that bell icon so you won't miss any of my new videos. Take care.